offer vein removal? No, I think that would be a vascular surgeon. So presumably that's kind of like little veins often on the legs, and they can be removed with laser or little micro injections, and a vascular surgeon do that. I think cosmetic doctors might be doing it, and there might be some actually there might be plastic surgeons that do it. In myself and the other guys in the clinic, we don't do it. So at the Staiano clinic, we don't do vein removal. And I would probably point you in the direction of a vascular surgeon for that. What is the big deal about going to Turkey for surgery? I've been 4 times in the past 2 years, and everything's been fine. Yeah, this was an email I got from someone the other day, and I thought I'd talk about it on here because there is quite a big deal at the moment in terms of going abroad for surgery, and for whatever reason, Turkey seems to be mentioned quite a lot. And I think the important thing to realize is that it doesn't mean that everyone is bad in Turkey and everyone is good in the UK, for instance. It doesn't mean you're going to be fine in the UK and you're doomed if you go to Turkey. So there are very good, very well respected, very well trained surgeons in Turkey. It's not like, this or anywhere abroad. There are, obvious. I mean, I say obvious. Is it obvious? There are very well trained surgeons everywhere in the world, and there are also badly trained surgeons everywhere in the world, unfortunately. But it's not like specifically a certain place has got bad surgeons. And what I have seen in my own practice, and what seems to be coming through with the BARPs are campaigning quite a lot about this at the moment, is the aftercare seems to be a problem. It's a combination of the aftercare problem, and there does seem to be some quite questionable surgery, some quite bad complications coming back, some bad results, some bad things happening to people that would not be in any way acceptable in this country. And if a surgeon was getting results and doing things that we're seeing, there would be significant repercussions. And I think the difficulty is having that accountability, having that feedback with the surgeon, with the clinic. And I think that's really the important thing if you are considering going abroad. I mean, I think we accept that people will go abroad for surgery. I don't think we're saying don't go abroad for surgery, because people will, because there's a significant difference in the price. But you've got to ask yourself, why is there a significant difference in the price? You've got to make sure that there are processes in place to look after you once you've had your surgery. If you have any questions, if you have any concerns, I can't tell you how many people reach out to me and are asking for help when they've recently had surgery. And I always say to them, look, the price of surgery includes all the aftercare. That's the way it's structured. There's one price which includes the surgery and all of the aftercare. It is not one price for the surgery and one price for the aftercare. So that might be why it was a lot cheaper, because maybe they didn't have a great aftercare. And it's not very helpful to say that to people who are struggling now, but you can say that to people who are in the research phase. Say, look, have a look at the aftercare, have a look what sort of processes are in place. I hear all the time that it was a WhatsApp number and they've blocked me on the WhatsApp because I'm complaining, and then that's it. They've got no way of contacting them, which is fairly shocking. Have I got some kind of hue on me? Which is fairly shocking and would not be tolerated in this country. And so that's just something to be aware of. I'm not saying everybody does it. I'm not saying that there are clearly a lot of people who go abroad, who've been abroad, who've had great results and are very happy with everything. It just seems to be a disproportionate amount of people who are having problems, having concerns, not getting their concerns listened to, and not being looked after. And the problem is they're really struggling to get help in this country. And in fact, the person who wrote this email said, my GP is very supportive. And I'm like, really, you shouldn't really be involving your GP significantly. We always write to your GP, let GP know you're having a procedure done, but any follow-up, any aftercare is done by us, and to say go to your GP if you've got any problems is not really fair on the GP. There's a lot of pressure being put on the NHS by having to do remedial surgery, and then they will only deal with the complications. They will remove the implant if it's infected. They will deal with the acute infection, but they won't deal with the sequelae after that, the cosmetic implications or the scarring or the other things that might be of issue to you. And one that's kind of, in a way, putting a burden on the NHS. And two, it may not be ideal for you because you might want to have the cosmetic side of things addressed because presumably you've had cosmetic surgery for a cosmetic reason, and if it doesn't look right, then you're understandably going to be unhappy. But it's, as I say, it's very hard to just take someone on to just do the aftercare. The price you pay includes the whole package. So when you've paid that to a surgeon, whether it be in the UK, in Turkey, or Prague, or Brazil, or it doesn't, anywhere in the world, whenever you paid for your surgery, that surgeon, that clinic then has a responsibility to look after you and to make sure it's all heals well and you're happy with your results. That is part of the price you've paid. So if you're not happy and then at 1 week or 3 weeks you go to another surgeon and say, look, can you help me? You may struggle to find the surgeon to help you because we're not set up to just have an aftercare package. And so that it is difficult when talking to people like that, because you kind of feel unhelpful, but at the same time it's like that is what you've got to be doing in your research phase. You're looking for someone who's going to look after you, looking for someone who's going to listen to you and look after you. And I'm not saying everybody abroad doesn't do that and everybody in this country does do that. I'm not saying that at all. I'm just saying if you're going to have surgery, those are the sorts of things you need to be looking out for. What sort of comeback have you got if you have questions, if you have concerns, if you have a little niggle? Because let's face it, there's a lot of niggles, concerns, maybe not massive complications, but if it's a concern, swelling, lump, bump, asymmetry, can take ages for these things to settle, and you need to be nurtured and looked after that period. So and it does seem to be a problem at the moment. So we're all trying to raise awareness of this to empower the patients. Everyone says, oh, there should be legislation, etc. Yes, okay, there should be legislation, but that's going to be sometime in the running, and whether or not it ever comes about. And in the meantime, I think the onus is on us as reputable plastic surgeons to talk to people, to let them know what sort of service we offer and what sort of aftercare we offer, so then they can compare it with other places and make an informed decision as to where to go for, rather than just saying that place is £10,000, that place is £2,000. Well, I'll go with the £2,000 one. So rather than just saying we're £10,000, we've got to say we're £10,000, and that includes all of the aftercare. This is how we do it. This is when you see the nurse. This is the sort of communications we have. This is the sort of aftercare policy. This is what we'll do if you're unhappy with the result. And this is what's covered, and these are the sorts of conversations we need to have with people, so that then when they go to the other place, they can say, what is the how am I followed up? What's the aftercare? Will I be speaking and seeing the surgeon again? These sorts of things. And the problem is, well, not the problem is, I mean, the fact is, a lot of cosmetic surgery is it's got a low complication rate. So there is always going to be a lot of people who are absolutely fine. But the problem comes when there is a complication or there is an issue. They can be significant. They can be really significant. I mean, it is not minor surgery. Just because cosmetic surgery does not make it minor surgery. It is still significant surgery, and there are potential for significant complications that might need intervention, might need help. And there's an awful lot of people who are lost, who are not getting the support they need, and having to rely on surgeons in the NHS and having to rely on GP and things like that, who are not equipped for this sort of stuff, and who are probably only helping in the sort of basic way, rather than really trying to embrace and focus on the whole issue. So just be aware of asking questions about your aftercare, about contact with the surgeons, and how you're going to be dealt with wherever you're having the surgery, whether that be the UK or whether that be abroad. That's the message, really. And it's not trying to say everything abroad is bad. Just be aware and ask the questions. Be informed, so you can make an informed decision as to